A Christmas rush of a different kind. Thousands turning up for their boosters as the numbers infected with COVID soar.
Just like to relax your arm down.
For now, the NHS is coping, but it's not clear for how much longer. One consultant working on the front line says it's tough to keep going.
The staff are exhausted and do want a bit of a break, but I don't think we're going to get it. I often get called in at all hours to say, can you please cover? Can you come in even if it's for an hour or two? So we're putting out fires, literally plugging gaps as we can on a day-to-day basis. It's relentless and there's no pause.
Health bosses are worried. One saying today, the NHS is on a war footing and staff are taking the fight to Omicron, all while seeing a worrying high and rising increase in absence due to COVID. In hospitals, it means routine operations and some outpatient appointments are already being cancelled, adding to the backlog. The number of NHS hospital staff in England who were absent for COVID reasons rose to almost 19,000 in the latest figures. That's a 54% increase in a week.
What you've got in the NHS at the moment is something that's incredibly difficult. You've got a very, very busy non-COVID care, urgent and emergency care pathway, getting through those care backlogs, extending the booster vaccination campaign, growing numbers of COVID patients, but not exponential growth. But at the same time, we've actually got significant numbers of staff absences. It really is very, very pressured inside the NHS at the moment.
In the last 24 hours, nearly 120,000 people have tested positive for COVID, another record. But the latest government data suggests the risk of Omicron patients being admitted to hospital is 50 to 70% lower than with the Delta variant, although it also shows the protection provided by the booster vaccine fell by 15 to 25% after 10 weeks. Tonight, as people headed home to see their families, the message from the government remained Christmas won't be cancelled.
People should enjoy their Christmases with their families and friends. Of course, remain cautious, and we will keep the situation under review. We're learning more all the time, as we have done from this new data, and we will keep analysing that data. And if we need to do anything more, we will, but nothing more is going to happen before Christmas.
New restrictions come into force in Wales on Boxing Day and soon afterwards in Scotland. The chances are that if cases continue to rise, some new measures may also be needed in England to protect the NHS.